Let's move on to our current event for the week. No one should have to be fighting cancer and insurance at the same time. Okay. This is just on the heels of that untimely death of the United Healthcare CEO. So this is kind of within that realm. We're following Arit Sukalas. Okay, guys, I'm horrible with names. I'm going to keep saying it until you guys really understand. I'm really horrible with names, so I apologize. She has spent hours on the phone arguing with her insurer while receiving infusions in the hospital because she needs chemotherapy treatment. She was diagnosed with leukemia 3 years ago. She's 26 years old, and she was stunned to learn that her insurer's coverage of the drug she needed came with a $13,000 monthly copay. What the hell? And she's a recent college graduate. She can't afford that. She ain't got that kind of bread. So she was forced to go without medication for 3 months when she was finally able to obtain it through the drug manufacturer's assistance program. So if I'm reading this correctly, her own insurance company that she is with couldn't help her. So she had to go to the drug manufacturer's assistance program to get help. What's the point of having insurance then? No one should be fighting cancer and insurance at the same time, she says. Agreed. Hella agreed. We live in a country where people are truly kicked down when they are at their weakest and most vulnerable, both physically and emotionally. I should have had this story come with a true warning because this is madness. Americans' pent-up fury with the nation's health insurance industry burst into the spotlight last week after the fatal shooting of United Healthcare CEO Brian Thompson in Manhattan. They flooded social media with posts and videos about denials of medical treatments and claims. Okay, I'm sure most of you guys have too, have been seeing online all of the comments, all of the posts. Like some of them, some of the responses have been tragic, sad, infuriating, angry. A few of them found ways to find levity and throw in humor, because obviously comedy comes from tragedy in a lot of ways. But it has been alarming to see how horrible the healthcare industry is in America, how bad it is, because you kind of get a feel for, like, it's not that the greatest, especially since we're like number 42nd in the country as far as life expectancy. In the world as far as life expectancy. I think that's the correct number. But then to really have it like in your face with thousands upon thousands of stories and comments about people who have been dealing with this, people have been suffering. Some people who can't comment because they've died because they couldn't get treatment. Monday, so police this past Monday arrested Luigi Mangione, the suspect in this executive's killing. This is wild. So the majority of insured U.S. adults had at least one health insurance problem, including denial of claims. The majority. Not half, not a third, not some, the majority. When you say majority, are you referring to the 99%? Just asking for a friend. So, many stories have talked about problems with having treatments and care denied, all the ones they were posting online, about receiving unexpected medical bills and getting the runaround when trying to resolve the issues, all while paying high premiums and out-of-pocket costs. Several medical providers also wrote of the hours they and their staff spend trying to get their patients' care approved. Everybody is working in tandem except for the freaking insurance companies. The doctors, the nurses, the medical practitioners, the professionals, the patients, everyone is trying to uphold, the Hippocratic Oath, right? The medical insurance should have their own version of that. Insurance on its own, I feel like I don't want to use the word scam. I also don't want to not use the word scam. So, double negative. Car insurance, you pay all this money, you get in an accident, and they either they cover it, sometimes they drop you. What was the point of me paying all this money to you if you're just going to drop me when I have it? Isn't this supposed to be what it's for, in case? Now, I don't say most cases, but in a lot of cases, it's more, you're not looking at like life and death. Although, car insurance is that's right behind here for me as far as like, it needs a revamp, it needs something, a restructuring. They need to be held to some kind of law. So Isaac Rosenblum, who's 43, doesn't know whether he has cancer because his insurer won't approve an MRI for nodules on his lungs, which were found on an x-ray when the resident had an appendectomy. Yo, that infuriates me right now. They won't even approve an MRI to find out if he has cancer? Are you kidding me? Do I have to wait until I start coughing up blood? Rosenblum says. Yeah, I think you have to. I think it's what they want. Then this dude's a paramedic and a father of 4. All he does is help people. Okay. Okay. Some Americans feel they have no choice but to get the care their doctors recommend, even if their insurers deny it, which can result in massive bills. How massive? Well, let's take a look here. Roughly 41% of adults had debt caused by medical or dental bills, according to a 2022 KFF healthcare debt survey. And for funsies, let's read the next line. A separate KFF analyst of 2021 census data suggested that people owe at least $220 billion in medical debt. That's in 2021. That's 3 years ago. Who knows what it is now? Let's find. Here's another story. After Melanie Duquette, 70, had extensive back surgery earlier this year, her doctor sent her to a rehab center to recover since it wasn't safe for her to be home alone. But after 6 weeks, her insurer said it would not pay for any additional time, even though her medical team argued that she should remain. She was afraid to leave because she still needed help getting out of bed and going to the bathroom and felt unsteady on her feet. So she stayed for 7 more weeks. And what was the result of that? A $14,000 bill that she can't afford to pay and may have to declare bankruptcy. How are we arguing as a country, as a people, with each other about trivial things when real stuff like this needs to be addressed and handled and worked on? Like, what are we doing? Adding to her anger, oh, you guys don't love this. She paid several $100s a month for the best insurance plan her employer offered so she'd have more comprehensive coverage. I'm getting so worked up right now. Okay. She paid several $100,000 a month for the best insurance and still ended up with a $14,000 bill because they wouldn't approve of her for a longer than 6 week stay in which her medical team argued that she needed it, that it was unsafe for her to be home alone. Obviously, this is not first degree murder, but is it not accessory in some way? Are they not accessories to murder? Like what am I reading here? They deny people care while they're making millions of dollars, said Duquette. This is what happens when you make human care, medical care, a profit system. I know that there are problems with universal health care. I know that everything has its own issues and own challenges, and that doesn't necessarily mean that it's the end all be all answer to everything. But we gotta do something other than this. This is not it. This is definitely not it. I don't know what we could do. I don't know how to make this better. I don't know how to improve upon this. I don't know. But we gotta do something. This is ridiculous. This is wild. Oh, it also reminds me of I'm saying this strictly off memory, so if I'm incorrect, maybe I'll put like the corrected version, down here. But I remember years ago when EpiPens were affordable, and then a lady came in and bought it out, or bought the company or something, and overnight she increased the price of EpiPens by like 300%. And she was allowed to do that, and no one stopped her. There was no law that said that she couldn't do that. EpiPens are for people who have allergies, severe allergies, like a flare-up that could, if they don't like get the EpiPen, it could kill them. Their throat could close up and they could die. And she was able to raise it 300%. Up is down, down is up. Like, how? How is there not more regulation in place? How? I don't know, guys. We got to do something. We have got to do something. This is wild. I don't know. I wish I knew. I want to do more than just yell into the ether and be angry. I don't know how to change it. I know policies and lawmakers, it's important. I know politicians serve some purpose as far as like helping to, I said some purpose. I mean, they serve a purpose to help with the quality of life. I think we need to get back to the quality of life versus the quality of sales. I don't know. I wish I had a more happier note to say, but I don't know. So, do you guys have any horror stories? Let me know. Or do you guys have any suggestions? Let me know. Or are we going to see more CEOs biting the dust because people are fed up and frustrated? We'll see.